Hello and welcome to ALCA's Aging Life Care Moment. In this series, we talk to different aging life care professionals to hear how they got started, the value of ALCA membership, and ways to diversify in different areas. Today, we are talking with Austin Caton, Family Caregiver Support Coordinator at Tar Council on Aging. Austin, welcome, and tell us, how did you get started and how long have you been practicing in the field of care management?
Well, thank you, Courtney. I have been doing it, I say, since about 2012. I was first out west working I don't know if you're familiar with Boise, Idaho, but I worked out there. I did coordinating in homeless shelters with the aging population. And then I worked on the Medicaid services side, doing behavioral health plans, training on the staff, and care coordination. And that was extremely rewarding and yet challenging because you're dealing with a high level of the IDD population mixed with geriatric. And I worked with the deaf and hard of hearing, which because I am an ASL interpreter as well. So I kind of was able to bring that aspect in, which was, I think, rather unique and exciting, to be able to work with that population. And a lot of times they do cross over. And then I moved from there to doing care consultation on the phone and doing telephonic case management. And then that was nationally. And I even had a lot of calls I would get from England and Ireland, which is a whole different healthcare system than ours. And I found that fascinating. And I got to learn the kind of the ins and outs and where to go for resources there. And then I went from there to the area agency on aging.
That's really interesting. Just knowing a little about your background with a degree in psychology, can you just talk a little how you got from that into where you are today?
Sure, sure. So I started out in Boise, as I said, working in the homeless shelter and all of that. And I was really able to see the high prevalence of substance abuse, of mental health disorders that really just permeated that population. And I got to work a lot with the veteran services too, helping with the you know non-pension and service-connected pension benefits and all of that. And so then I moved on and completed my master's degree in abnormal psych because I found that really fascinating. So a lot of the work that I do now, I get to really integrate all of that. When I'm on a call, I can kind of do a mental health self-check with people, and really get in depth talking with them about if they're suffering any type of mental disorder, or if they, are on any type of medications. And we talk about, medication management and agencies in our area. We're in a very rural area in our region. So I think that's been the most challenge, is trying to find those agencies that take on the IDD population, and the geriatric population as well, because a lot of times they're separated, at least in my region. And so trying to partner with those agencies have kind of catapulted being able to integrate services. But that's been my true passion. It's just really working with the population and working with the mental health side as well.
Oh, that's really such an interesting journey into that. And so tell us, how long have you been a member of the Aging Life Care Association, and what's your experience been in terms of membership?
Well, my experience has been amazing. I think a few months ago did our southeastern region. They did like a southeastern region conference where we all get to get on, because of course it's Zoom because of due to COVID, and that was amazing. Being able to kind of to really talk with other aging life care professionals. I would say I think I joined in 2016, 17, I think. Yeah, I think that's correct. So I joined about then. So I'm a relatively new member, but there's been a lot of benefits. So one thing I really like about the Asian Life Care Association is they are very big on education. and I see a lot of evidence-based stuff. So I see a lot of the presenters that present are, just experts in their field. And I really enjoy just sitting and going through the website and resources, and really applying that into the stuff that I do here at the area agency.
That's great. Well, one of the things that we're looking at in terms of membership is diversifying and, making it, much more available and having more people aware of it. What do you think that Alco could do in terms of bringing more awareness to this career for men in particular?
I really think that maybe coordinating with universities, national universities, and presenting and speaking, and maybe even going to certain professions, just the way the cookie crumbles are more male identified as female, and maybe targeting some of those would be very helpful. Say doctors, even though female, there are a lot more female doctors now, but even nursing, you're seeing more a rise of more male nursing, and even um, the social workers are starting to there's more and more of those. So I mean, I would target more of the male population, because I think um, a lot of the population, such as specifically LGBT, or the racial diversity, could benefit from having more male geriatric care managers.
Yes, exactly. And, the June being Pride Month, we're really looking at that topic too. So, well, thank you so much for your insights today. I really appreciate it.
Thank you
Thank
for
you.
having me.